Hi everyone, this is Andrea. I'm going to quickly walk you through the assignments for clinicals for week one. So remember, you're going to be making up 12 hours of clinical time. So there are several assignments and it will take you some time to get these done to be equivalent to being in clinical. So let's go ahead and walk through. So under the student view, you're going to go to content. And then under content, it's already pulled up, but I'm going to show you how you get there. If you scroll down, there's a clinicals tab. You'll click there. You'll come back to this screen and you'll notice that there are three things that are labeled clinical week one towards the top. So these are primarily the tasks that you'll be completing, and then one additional portion of the clinical decision making worksheet. And I'll talk about that in a minute. So the first, clinical week one, pneumonia COPD. So these are case studies that have been developed. They do a really nice job walking through patient scenarios and having you critically think through all the components just like you would in clinical. So they're a valuable tool. They are going to take you some time, but if you take it seriously and think about this content related to classroom content, it will definitely be a benefit to you in the long run. So this first client has pneumonia and COPD. Her name is Joan Walker. She's an 84-year-old female. And some of the key concepts you'll be working on. And what it does is kind of step-by-step walks you through this patient's history, vitals, labs, all kinds of things. So you'll get a section that you'll read, and then you'll respond to what you were able to pull out of that section as relevant data that's clinically significant. And then you'll get some vital signs and you'll pull out of those vital signs what was important, why was that data clinically significant. So, and that will continue on through the entire case study. When you get to this portion that says 12 lead EKG, you can skip this section right here. That's the only part of the case study that doesn't apply to things we've already talked about in class. So you'll work through this entire case study about this client. So that's the first one. The next one is clinical week number one, urosepsis. So this is another full case study about a client that has urosepsis. This case study let me scroll up here just a second. This case study for Jean Kelly, an 82-year-old female, does not have the EKG cardiac strip portion. So there's no portion that you'll be skipping, but it's set up very similar to the previous case study as far as the layout. So you'll complete that. And then moving back, the third component is urinary catheterization. This is set up as a case study, but it is a lot faster than the other two. So the other two case studies, the creator states that they take about 3 hours per case study. So when you're trying to use your time management skills and delegate your time appropriately, just keep that in mind. Urinary catheterization skills and reasoning. So this walks you through kind of a very appropriate shorter case study that applies to what you were assigned to do for your lab. So Sheila Dalton, a 52-year-old female, and then similar layout, but not as long. So that is the third part of your assignment. The last part of your assignment is the clinical decision-making worksheet that you are familiar with doing from Nursing Concepts Clinical. Debbie and I would like you to choose either, not both, but either the pneumonia COPD case study or the urosepsis case study, and complete questions 12 through, hold on one second. We're not going to complete this last page about meeting our short-term goals and things like that because you may not have been able to do that. But what we want you to do is just this one page that starts with, I'm sorry, there we go. Starts with question 12, where you're going to develop an appropriate nursing priority, short-term goal, and then your nursing interventions and your rationale based on your patient. So just this page right here. So you can download this and type on it. Same thing with all of the case studies. They are fillable PDFs. So I would really encourage you to download them and type on them, and they'll be so much easier to upload back into the Dropbox, save that way. If you need to print them out and write your material, that's absolutely fine, but then you're gonna have to upload every page back into the Dropbox, and that's gonna be a lot more time consuming, both for you as a student and for Debbie and I as your instructors. So keep that in mind. So just this page starts with question number 12. Again, just pick one of the longer case studies. You don't have to do this on both. Okay, so that's everything that you'll need to do to complete clinical week 1. Remember, it's a pass or fail, and that means that you have to have everything filled out, good details, and otherwise you will have to redo some of the components to receive full credit. So it's a completion type of grading for these. So I do want to show you, if you go to more tools, drop down to your assignments, and if we scroll down, you'll notice that there's a Dropbox. It opens on April 20th at 9 a.m. and it closes on Saturday, April 25th at 9 p.m. So you have the week to get all of this done. Clinical paperwork 1 Dropbox. So put everything in there, and you can add things as you complete them. We will not start looking at these until everything's in there for you. So you can add things as you get them done, and then by the end of the week, just make sure everything's in there. So again, it's the clinical case studies, pneumonia COPD, the clinical case study urosepsis, the shorter clinical case study for urinary catheterization, and then the 1 page of the clinical decision-making worksheet where you're going to develop goals and interventions for one of the larger case studies, either the pneumonia COPD or the urosepsis, whichever one you choose. So if you have questions, please let us know, but hopefully this will help you stay organized. All right, thank you.